Welcome back to the Morning Blend. Our next guest helped to implement a new surgical technique for patients who require both a kidney and a liver transplant.
It's called Bloc, and it means faster recovery times and going home sooner than ever before. We're pleased to welcome Dr. Ajay Sahashpal, the Director of Transplant Services at Aurora Health Care. Thanks for being here.
Well, thank you for having me.
Nice to see you.
You too.
This sounds exciting for people who need this sort of transplant. How do you describe Bloc?
So basically, when someone is critically ill and they need a liver transplant, which is about 6,000 done a year in this country, their kidneys start to fail. So about 10% of those patients need a liver and a kidney. And so what we did, the innovation we came up with, is just putting the liver and the kidney together and implanting them together rather than through two separate incisions.
Okay. Is that what makes it so innovative? Is that you're putting them together?
Yeah, putting them together. We have a table at the, believe it or not, a back table where we put things together, just like plumbing. And then we use a traditional liver transplant incision to put the organs in together. So you have one incision, the organs come off of ice faster, it's a shorter operative time, faster recovery for patients.
Are they normally that close?
No, usually you end up with one incision in the top and then one way down towards your leg where we in the lower belly where we put the kidney in. So you get two big incisions rather than one big incision.
But how about the organs themselves? Are they normally that close together as how you're implanting
Actually, yeah. So your right kidney sits right underneath your liver. So the right kidney is very close to the liver, yeah.
So it makes sense.
It makes sense.
It's a lot different than the standard approach, and therefore patients are recovering much quicker, right?
Yeah. Yeah, it's very nice to see. It's nice to see that you can take somebody who's critically ill, transplant them, and help them recover faster.
Yeah. What do your patients say? What do you hear? How do you see them responding to this?
So far they've been very pleased. I mean, some of the patients have found it quite novel, and they like to tell their friends about it. But really, we just came up with it because I really thought it was a better thing to do for patients to help the recovery.
Yeah.
So, I mean, I'm surprised at how innovative it has become from other people. So I have some friends across the country that have started doing it for their patients, which I was not expecting to have happen. We were just doing it for our patients because we thought it was the right thing to do.
Did you guys come up with it?
So our team did, yeah.
Really?
So I started doing a version of it years ago, and the most recent version that we've been doing now for about 2 years I came up with, yeah.
Do you get other surgeons in other parts of the country calling you and going, hey, what's up with that thing that you're doing? I want to try that with some of my patients.
Yeah,
too.
I had some surgeons from Europe and some other surgeons in the country call and ask about it. Yeah,
that's
kind of
awesome.
neat.
Yeah. What I wonder how common it is, because I was thinking, what type of condition or illness, disease would someone have that would indicate that they need both a transplant of a liver as well as a kidney?
So it's about 10% of the 6,000, so about 600 a year end up needing a liver and a kidney. And usually someone who's been waiting for a liver for a very long time, typically, and their liver starts to fail. And as that happens and they're in the intensive care unit waiting, their kidneys fail. And then they're on dialysis and then you end up needing both organs.
I see.
So you're already taking very sick patients. So we're trying to help those patients recover faster.
And if someone is kind of in that waiting period, they're on dialysis, they're not doing well, can they make a full recovery?
It's tough. I mean, so yes, the goal is to make a full recovery, and the majority do. However, if you look at liver transplants and heart transplants as a whole, if your kidneys fail, that's the #1 predictor of mortality. Yeah. So it's a marker of how sick someone can be.
What made you want to become a transplant surgeon?
It's interesting. I never thought that's what I would do. When I went to medical school, I thought I was going to do family medicine, and then I fell in love with surgery. And I worked with a liver transplant surgeon who did the first liver transplant in Canada, and he made me fall in love with liver surgery. So.
That's interesting. Yeah. Fell in love with liver surgery.
Yeah.
Not heart surgery. You didn't fall in love with heart surgery.
No.
Okay, I always think this is fascinating to ask doctors, especially someone who deals with an organ that's so vital to us. What things would you never do because you know how it affects your liver?
I think for most things, as long as you do things in moderation, it's okay.
Yeah.
It's going to extremes that's the problem.
It's a very regenerative organ.
Yeah, the liver has the ability to regenerate.
Yeah.
The thing that actually made me fall in love with liver surgery was when children are born with congenital conditions and they need liver transplants acutely for something that really had very little to do with behavioral patterns in terms of alcohol, hepatitis C, etc. So
you're doing
this choice.
Yeah, this procedure in children as well as adults?
No, I'm only doing it in adults.
Only in adults.
Yeah, but I used to do it in children at another place in another city. Yeah.
Okay. How many of you performed, do you know?
So probably about 50 over the years.
Okay.
Yeah.
Okay, so it's not super common, but
No.
it sounds like when it's indicated, it's really important.
Yeah, no, it is. And one of my colleagues in Ohio has done 6 already in the past year. So it's
Thanks
quite.
to you?
Thanks to our team. Thanks to
That's
Milwaukee
awesome.
Innovation. Yeah.
That's so great. I love it. And people can find out more. It's called Bloc, right?
Bloc.
Bloc. And find out more about the wonderful physicians at Aurora and about you, doctor, by going to aurora.org for more information.
Yeah.
Great to meet
Thank
you.
you. I appreciate it. Thank you.
Thank you.